Hello, we are here today to talk to you all about inherited heart diseases. We are all born into an unknown environment. We are unaware of who our parents are, where we are, or what we look like. However, our genotypes have been predetermined and will set the stage for our progression through life. With heart disease being the number one reason for a high mortality rate in older adults, it is inevitable to wonder how it is possible that each year more than 655,000 people die from heart disease. One factor to consider is inheritance. All organisms will inherit some aspect of each parent, grandparent, or even great-grandparent. Genetics can be both predictable and unpredictable, making it harder to determine what offspring will or will not inherit an altered gene.
What are inherited cardiac conditions? Abbreviated as ICC, it's an umbrella term covering a wide variety of relatively rare diseases of the heart that are caused by genetics.
In this presentation, we will take a brief look into the different types of inherited cardiac conditions, the causes, the treatments, the possible prevention of these conditions, and touch on our own views of a call to action. ICCs are caused by a fault, also known as a mutation, in one or more of our genes. If someone has a faulty gene, there's a 50-50 chance that they can pass that faulty gene on to their children. There are multiple different ICCs, but today we will only take a look at two of them: familial hypertrophic cardiomyopathy and atrial fibrillation.
Familial hypertrophic cardiomyopathy, abbreviated as FHC, is one of the most common inherited cardiac conditions and affects people of all ages. This disease thickens your heart's muscle. This thickening most often occurs in the interventricular septum, a wall between the two lower chambers of your heart. The thickening of this wall may prevent blood flow from the heart, causing the heart to have trouble pumping blood. Most people with FHC experience no symptoms, but for those who do, they often occur when exercising. These symptoms include chest pain, palpitations in which your heart pumps as if it's racing or skipping, heart murmurs in which you can hear abnormal noise from your heart, shortness of breath, and even fainting. In order to diagnose FHC, your doctor would take into account your symptoms and medical and family history. They would also order tests such as echocardiograms, cardiac MRIs, and electrocardiograms to diagnose FHC or any other possible cardiac condition you may have. These tests can analyze your heart's thickness, pumping, and general performance.
Here, we will talk about some possible treatments for FHC. One possible treatment could be an implantable cardioverter defibrillator. What it does is that it will detect a very fast or abnormal heart rhythm, and it will deliver a small but powerful shock to the heart muscles to cause the heart to beat in a normal rhythm once again. There also could be an administration of medications. Such medications could be a beta blocker or a calcium channel blocker. These are known to help reduce the heart rate and reduce blood pressure, which could actually relax the heart muscles and allow it to feel better and pump more effectively. And if medications are not effective in treating FHC, then we can opt for surgery. One surgical procedure could be septal myectomy. This is where the surgeon removes a small amount of the thickened septal wall to widen the outflow tract within the heart, thus reducing the symptoms of FHC. What is atrial fibrillation? Well, as you probably know and could probably feel at this moment, we have a rhythmic beat of our heart. This beat comes from the chambers of the heart relaxing and contracting. This relaxation and contraction is due to electrical signals that begin in the SA node. However, during atrial fibrillation, the upper chambers, which are known as the atria, will begin to beat irregularly due to signals that don't actually begin in the SA node. And when that happens, this causes a fast and chaotic rhythm in the atria. An exact cause of atrial fibrillation is unknown, but it is more common in older adults, specifically those with high blood pressure, which is also known as hypertension. Next, we will discuss common symptoms of atrial fibrillation. Based on recent research and data analysis on patients that were diagnosed with atrial fibrillation, 65% of patients experienced heart palpitations, which are sudden pounding, fluttering, or racing sensations in the chest. 50% experienced fatigue, which is a lack of energy or feeling overly tired. 43% experienced shortness of breath, which means that they had a difficulty breathing during normal activities and even at rest. 30% experienced malaise, which is a term used to describe a general feeling of discomfort, lack of well-being, or illness. Others experienced dizziness, anxiety, chest pain, and other associated symptoms. So now that we know about the common symptoms of atrial fibrillation, how would we actually diagnose this? So first, the most important is to take a thorough history and physical exam. From there, we can use our excellent reasoning and logical skills to decide which diagnostic test we should perform. One of the first diagnostic tests that a physician would use is the electrocardiogram, or as commonly known as the EKG. It's a test that examines the heart function by measuring the electrical activity of the heart. Other possible diagnostic tests include the echocardiogram, cardiac stress testing, blood work, and a sleep study, thus giving the physician reason to believe that atrial fibrillation is the diagnosis in a patient. Now that we know about some of the symptoms of atrial fibrillation, we can now discuss some possible treatments. One of those treatments is a medical procedure known as cardioversion. It is a procedure that restores a normal heart rhythm in people with certain types of abnormal heartbeats, which are known as arrhythmias. This is usually done by sending a shock to the heart through electrodes placed on the chest. Another form of treatment is a non-surgical procedure known as catheter ablation. This is where a thin, flexible tube known as a catheter will be inserted into your blood vessel and guided to your heart. There, it will begin to zap the spots of your heart that are causing these arrhythmias, which will hopefully result in a correction of the electrical current within the heart. A patient may not need to go through the two previous procedures. They could be prescribed a medication, for example, digoxin. It's a type of drug that's function is to slow down our heart rate. It will improve the filling of blood of our ventricles, which are the two chambers of our heart, thus correcting the different volumes of blood that is pumped out with those who experience atrial fibrillation. With all that we've learned and discussed within this presentation, the question still remains, can inherited cardiac conditions actually be prevented? Unfortunately, there is no straight answer, but what researchers have found is that in order to reduce your risk of heart disease, it is imperative to live a healthy lifestyle by maintaining a healthy diet, being physically active, reducing intake of alcoholic beverages, reducing or completely stop smoking, and controlling your blood pressure. These, amongst other healthy lifestyle habits, are known to reduce the risk of certain cardiac conditions. As we conclude our discussion of inherited cardiac conditions, where we touched upon what inherited cardiac conditions are, examples of inherited cardiac conditions such as familial hypertrophic cardiomyopathy and atrial fibrillation, we can now move to our call of action for those who are diagnosed with inherited cardiac conditions. We will begin with our patient's call to action. Patients should be aware of their family history, specifically history that involves cardiac conditions. If a patient is aware of their risk of cardiac conditions based on their family history, it is imperative that they inform their physician and schedule a screening. As for researchers and physicians' call to action, there should be distribution and execution. This means highlighting and utilizing the scientific understanding and therapies that we have developed in order to combat inherited cardiac conditions before they become an issue. There should also be discussion and management. There should be a recognition and a prioritization that manages and brings awareness to our population.